Hello, it's Rebecca Kelly, nurse practitioner at AIYANA Aesthetics, and this is Tuesday Talk. Today we're going to talk about cheek filler. So one of my most common treatments that we do in the clinic here at AIYANA is cheek filler, and there's a couple reasons why. I've talked about as we age, we have a lot of bone loss. That's why women kind of start getting osteoporosis as they get older, because our bone is just not as strong as it used to be. So with bone loss, we get the hollowing around the eyes. We also kind of get our fat pads that used to be nice and perfectly placed when we were young. They start spreading apart and they start drooping. And so when that happens, there's a couple things that can be a solution for this, but one of them is really addressing the mid-face and adding in cheek filler there. The reason being is because when we talk about filler placement, we always talk about the light reflecting off of certain areas of our face, and that gives us a youthful appearance. And when we can get the light to reflect off these certain areas on our face when you look at somebody, that portrays youth. And so with mid-face or cheek filler, it is addressing the obvious, obviously the cheek area, but with that comes a little bit of lifting power. We're not talking about a facelift. I have a lot of people come in, they're like, I just need this, I just want this done. That's a facelift. But if we're just looking to kind of, if you watch this line right here, just to soften, okay, you can kind of see how just doing that can soften. See that? Again, it's the light, because we see a shadow right here. It's not necessarily how deep that line is, because our kids actually have those lines if you look at them, but it's the shadowing part of that line. So when we add volume back into this area, we can get that lifting, and it will soften these lines. It'll also soften the jowling that happens as we age because of everything kind of drooping and dropping. It can help around the eyes too. Watch when I add that in, you can kind of get a little bit of an eye lift and brow lift when we strategically place the filler back here and use one that has a lot of lifting power. So there are many different types of fillers that we can use, and it all depends on what the patient is presenting with. So if they have a lot of more sagging skin, 60s, 70s, 80-year-olds where everything kind of is really drooping, then we're going to want to use something with a lot of lifting power and one that draws in a lot of water, so that when you put in that 2 blueberries worth of product, you're going to actually get some water that's going to come in there and help expand it. And then I love to use a product that really allows, when you're smiling, it moves with you. It has expression technique, and that's another type of filler that allows us to put it right in the cheek area, and when you smile, it moves with your smile, and when you're talking, same thing. So with cheek filler, you're looking at a longevity of about 18 to 24 months with optimal correction. So when we say optimal correction, it means that, when you come in for that medical consult and we talk about, what would be best for you, and come up with a customized plan, if it's 5 syringes of filler, remember that's only 1 teaspoon of filler. And to get what we need in the cheeks, that's really what you're going to be looking for. And that's, what it's going to take sometimes. And so that's optimal correction. We can always build upon that. We can start small and go from there. You're going to see subtle differences when you do it that way. But if you're really wanting to get that optimal correction, you're going to want to go with, what your injector recommends. So usually what we say is for how many decades you are is how many syringes of filler it would need. So if you're in your 30s, that would be 3, and that's all over the face, not necessarily just the mid-face, but if you're in your 60s, thinking like 6 syringes is going to be something. But again, that's the size of 6 blueberries or a teaspoon and a fifth. So it's really not that much product. So hope you learned something. If you have any questions, feel free to reach out. Make sure you like, comment, subscribe, share this with your friends, and we hope to see you at AIYANA soon.